there is action, people and movements and unions that struggle and fight against this condition. One example is the landless movement in Brazil. You know, it's a big movement made of more than 1.5 million members, and who have been struggling, fighting against, you know, the lack of land of many people in Brazil, and trying to implement different changes, different types of situations that improve the situation of workers. Another example is the case of informal workers, StreetNet in South Africa and many others. So they are fighting, so that's not a lack of hope. The problems are there, but also there are many actions and examples that show that the situation can be changed, can be improved. Okay, I'm going to skip that for the purpose of time. I'm going to move to the very last part of my presentation. I'm going to talk a little bit about politics and policies. Politics matter. Politics are important. You know, the old poem of Eric Fried, who is in command here, I asked. They said, the people, of course. I said, of course, the people. But who is really in command? Who is really in command? That means that, you know, the democracies we have today, I guess everywhere, are incomplete democratic procedures. And that is important because democracy and participation of people, including unions, including social movements, are important for public health. You know that today globalization, what is called globalization, is not a natural phenomenon. Globalization is just the latest phase of the capitalist evolution, the system of capitalism, and that has also different strategies to change the reality and to change policies. Strategies like the regulation of financial markets. We have a crisis today, an economic crisis, mainly due to this factor. The concentration of oligopolistic markets, private economic power, increased control of the state by companies, reduction of participation. Actually, if you are interested in neoliberalism, you can read, for example, the book of David Harvey. David Harvey, a famous British geographer, says that what happens for this crisis was that on one hand, in the 70s, capitalists were in a crisis of accumulation. They needed to maximize their profit, which, like, you know, any other change in capitalism along the years, along the century. And on the other hand, there was in the 60s and early 70s a tremendous wave of labor struggles, and the political power of the running elite of big corporations felt threatened. So today, in public health, we need to understand corporations. We need to understand the impact of corporations on health inequalities. Almost no research in that. We need really a lot of studies in order to understand what's going on. Corporations that are made in the United States, Europe, Japan. Right? These corporations are so powerful today. Out of the world's largest 150 economic entities, the majority are corporations. Walmart, BP, ExxonMobil, blah, 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 blah. All these companies that today have economic power and political power. Because economic power means political power as well. An example for public health, the global land grabbing that is going on today. These countries, corporations in Korea, in Saudi Arabia, in other countries, that buy enormous extensions of land, you know, as a resource, as a possibility to have more food security and to have in the future more economic benefits. Another example is Walmart, what we can call Walmart's nation. The largest company in the world, 1.8 million workers. Walmart has been heavily criticized for abuse, billing workers, firing employees, discrimination against lack of health insurance, and so on and so forth, right? So big corporations are having an important issue, it's an important issue today. And then we need to understand this, politics and health. We, as I said, we have very small amount of information on how politics influence health and health inequalities, or in this study a few years ago, by Vicente Navarro, myself and other authors, we said very few scientific studies have analyzed the consequences of the political agenda of governing parties for the health of the population. We need that as well. Policies matter. That's an example from WHO Commission. Look at that. You know, here you have poverty, different countries of the world, poverty. Look at United States. You know, United States, after transferring pre- and post-welfare state redistribution, decreases a little bit poverty. But Nordic countries, as you see here, decrease a lot poverty because of the redistribution and the policies they do in their own country. So many things can be done in terms of policies. Or for example, take this example, family policy generosity. Nordic countries, again, here you have policies, income for families, for women, for children. Here you have infant mortality. United States, the most powerful country in the world. Very poor family policies, very high poverty, and at the same time, infant mortality. Another example, employment. You know, people unemployed suffer everything. Your lifestyle, you take more alcohol, you have higher risky conditions in many respects. Now, this is an example for mental health. Let's focus only on this example. Manual group, you are employed. You are unemployed. Almost seven times more risk of having poor mental health. If you are protected, your risk decreases dramatically, almost the same as if you were employed. Policies, social policies matter, and matter a lot, are very, very important. More examples, things can be done. The case of India, Kerala. In India, there is a state in the southwest part, Kerala. You know, here life expectancy at birth, Kerala is much better along all the 20th century than India. But the interesting thing to know is that both men and women had higher education in this region of India, and this education is getting closer for men and for women. So the gender issues are, are closer. Reasons of Kerala's success: public school, preventive actions, food subsidy, larger political participation, left-wing governance. The example of Barcelona city, in my own country. You know, in the 80s, studies showing that this district of the city had higher mortality, much higher mortality than the rest of the city, for different reasons. That allowed the government, the city council, to make some policies, and, as you see here, while infant mortality reduced for the city, reduced at higher speed for this area of Barcelona city. So policies can be done. Policies matter, social policies matter, and can be done. More examples, Venezuela today, that in the media in many countries are attacked. Look at this. Human Development Index, I'm finishing. Human Development Index increasing, Gini coefficient decreasing, unemployment rate decreasing, and at the same time, barrio dentro, which is public health, primary care, and public health in general, increase the coverage, reduction of inequalities, strengthen community capacity, reducing child mortality, high satisfaction. So, I'm going to finish just with a few points. One is the need of making more studies and reduce health inequalities. How to do that is a matter of research, is a matter today of discussion. Probably many of you are aware of this book, The Strategy of Preventive Medicine, Jeffrey Rose, High-Risk Intervention, Population Intervention. High-risk intervention, you know, talk about people with high hypertension, interventions on the population, move to the population to the left. I don't know how many of you are familiar with this type of analysis. Now, this is rather new. I just actually finished and sent a paper about this type of research. But if we talk about health inequalities, one can think in many different scenarios. For example, we could think in this scenario in which population gets better, but inequalities get worse. We can make many policies in which, okay, the population better, but inequalities worse. You know, example, policies on smoking in many countries. In the case of the UK, you know, in the UK, smoking has decreased along the years, men and women, but as you see here, the gap opens. More inequalities, better population. Smoking, down, but inequalities, up. So that's not good. You know, what we need is basically, ideally, in terms of Jeffrey Rose, would be this. In other words, get the population better and improve inequalities. Okay, I'm going to finish. I'm sorry for, it took me a long time, but we started also very late. Challenges on health inequalities, research and policies. One, sustain interventions with a long-term program. That's important, that's difficult because of the changes in government. Two, study the solution, not only the problem. We need to study the solutions in order to reverse the problem. Three, and we talk a little bit about this today, mechanisms. Talk about social class, talk about precarious employment, analyze these type of factors, and also develop new methods to evaluate effects, avoiding a global one-size-fits approach for all. Things work in one place may not work in another place. Okay, I'm going to finish with 3 sentences. One is from John Berger. We live in and accept a society incapable of knowing what a human life is worth. One sentence from Vandana Shiva. Unless the poor of the world agitate for themselves to be heard, there will be no changes in their lives. And finally, one of the fathers of public health, Rudolf Virchow, who summarized his recipe in this sentence, you know, full and